Sorry, got a phone call. So I looked up and down the West Coast and all over the place and could not find a rheumatologist that would see possible Ehlers-Danlos patients or EDS. And because it's a very, very complicated disease, a very, very complicated syndrome. And I was going to go to the Mayo Clinic. And I got on Facebook, and there's some support groups, and I was like, hey, help me, I'm freaking out. I can't find a doctor, I live in Oregon, we can't afford this. And this gal said, there's this guy in Bend, call him. So I called, and the gal's explaining to me on the phone what we need all this, blah, 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 all your family history, this and this and this. And she said, normally the wait is between 9 to 12 months. I had it on speakerphone. Kevin was listening. We both turned and looked at each other, and I got tears in my eyes, which I frequently cry on the phone to doctors' offices all the time. I can't get into when. So I started to get upset, and she said, but we have a cancellation list, and a lot of people on that list don't want to come in because it's too short a notice and they don't have their paperwork done. The paperwork is very, very, very extensive. 2 full days in front of the computer doing it, and I did not sleep except for 4 hours during, I don't even know how many hours, very long, and I was super stressed out. And Kevin was out of town, and I was just tweaking out. She said, but you called 5 minutes after someone canceled an appointment. Can you be here Monday? And then I did cry. And I was like, oh, God, thank you so much. So she sent me the information. I only had a few days to get it done and turned in so the doctor could review it. Normally they have 2 weeks to review your records, all kinds of stuff. And as I'm doing the paperwork, I realized, gosh, wow, I've had like literally almost all this stuff happen. I was born with an inguinal hernia. I had another one at 4 years old. I've always been super flexible, which we always thought was super cool. I used to be able, my shoulders hurt. I used to be able to grab my arm and pull it like straight back behind my head. I'd go, yeah, the bruising. I'd go up to a desk and I'd put my arm out and it would literally like twist even, it's supposed to be like this. It would twist like that. My feet like go inside. I can bend down and touch the floor easily. I'm very good at yoga. Now we know why. And now yoga is very bad for me because Ehlers-Danlos Syndrome, I try to find the easiest explanation. Basically, Ehlers-Danlos syndromes, there are many, are a group of connective tissue disorders that can be inherited and are varied both in how they affect the body and in their genetic causes. They are generally characterized by joint hypermobility, joints that move much further than normal, skin hyperelasticity. Okay, I didn't know I could do this till then. That's super gross, I know. I had no idea until they're like, can you do this? It's like on this test. I'm like, ew, yeah, I can. Yeah, I can pull my skin on my arms up. Gross. So basically what it is, there are all these types. There's like 16 to 18 types, but they have narrowed it down to 6 different types. I was diagnosed with the hypermobile EDS and dysautonomia, which I'll explain in a moment. But so basically what it is you have a degeneration, or you're born with a lack of collagen and the elastic tissue that really holds your whole body together. Think of a marionette that, they're all strung together in their joints. Well, think about those pieces of rope or thread holding them together and them being cut way down and barely kind of holding on. that's what my joints do. So my shoulders, my wrist, my fingers, your elbows can, I'm not going to wood, my knees, my ankles, my toes even. I've sprained myself, I don't even know how many times. I have dislocated stuff, that's very common. My shoulders pop out of joint and I go, ow, and pull it back in. That happens all the time. Or my hip if I move wrong. I've been lucky and haven't had to go to the hospital and haven't put it back in. Been able to do it myself. Also, it is not uncommon to have a lot of bruising. And this freaks people out. And I try not to go out where you can see I've been trying to cover my arms. But this happened, it's big, I know. This happened, I don't know, a week and a half ago, 10 days ago, when I went over there and I hit my arm twice on a heavy door. This is because it's where my biceps connect, and it's been really hurting because of the injury in my shoulder, and so I was rubbing it and I didn't realize what it was doing. These that I have here, I have no idea how those got there. This is what happens to my knees just from me sitting there like at volleyball games, or just sitting there and having my knees together, or moving in bed, or up and about. I bump into things all the time, so I found out why I'm very, very clumsy. It's not my fault. So I've had all these strains, this joint dislocations, whatever, never thought about it, and this is why. So I'm going to read a list of the symptoms to you of Ehlers-Danlos. This is a disease that they type a rare disease, but actually they believe that it to be 1 in 5,000 to 10,000 people. It's just they don't know, they're not diagnosed yet, or their symptoms are not severe enough to cause a problem enough for them to seek help. Mine, as you know, over the last 4 years has rapidly, 4 or 5 years, rapidly declined. I've had a lot of problems, been in the hospital a lot, had to go to the hospital ER a number of times, which I didn't post on Facebook. I didn't post a lot of stuff because I was getting some hurtful and rude comments, and anyway, it's really hard to be in that situation and then have people be hurtful. Or I had someone literally that was there to represent the LDS Church, which I am a member of, and he saw me in the hospital once, and then he saw me in the hospital like the week later, then he saw me in the hospital like a month later, and he came in and said, "Are you sure you're not doing this for attention? If I could have moved, I would have jumped across the room and scratched that man's eye out." He was old though. And I said, "Don't you think that I wouldn't be in here? Don't you think that I would want attention for being the best mom, the best volunteer at a school, the best cook, the best house cleaner, the best all kinds of stuff, the best wife? Don't you think I would want that? Do you think I want to be here? I do not want to be here. I am in so much pain that you have no idea. I just know how to hide it. I'm in pain every single day of my life. Every day. And it just depends on, is it here on the scale, or is it way up here? Or is it so bad that I have to go to the hospital and they find something really wrong? I have a headache every single day. It might not be a migraine. Luckily those, oh gosh, knock on wood, have settled down. But I have a headache every single day. It ranges on a pain scale from anywhere from 3 to 7. If it's a bad migraine, 7, 8. I haven't gone to the emergency room for those in a long time because basically there's nothing they can do for me that I can't do at home, which is take a muscle relaxant, a Xanax, and try to sleep. And that's it. That's all I can do. You don't want to start narcotics. You don't want to go down that rabbit hole, and you sure as heck can't get any anyway. It's like impossible unless you have surgery and everything, which is fine, which is good. I don't want that. But I'm tired of being treated as if I am seeking that, or I'm seeking attention, or I'm a hypochondriac. I've been tired of that for a long, long time. But at this point, I hope I don't clock anybody who says anything. And at this point, I literally have a diagnosis to give them to say, no, I have this. That is why all of this is here. So I'm going to read to you the symptoms. Joint looseness, fragile small blood vessels, abnormal scar formation, abnormal wound healing. That takes me a long time. Soft skin, velvety skin, stretchy skin. I showed you. That was gross. A curved spine, eye problems, which I've been having, and I have this, it's called ptosis. I have this droopy eye that has gotten worse and worse over the last few years, and it's really bad when I'm really tired or in a lot of pain. It literally looks like this. It's so not attractive, and I hate it. I want to fix it. Okay, and they found something in the back of my retina just Monday at the doctor, so I have to go see a retina specialist. Wasn't a happy camper. Weak internal organs, weak uterus, weak intestines, weak large blood vessels, hyperelastic skin, fragile skin, hyperextendable joints, joint dislocation, bleeding tendencies. I bleed and bleed and bleed and bleed. Dropped something on my toe the other day. It did not stop for the longest time. It kind of scared me. Bruising tendencies. Yeah. Soft pseudotumors. I actually went to the dermatologist today, and he took 2 big ones out that I had on my arm. They're nothing. They're benign, but they're painful. And I've got other ones, and we'll do those later. And I've had them in the past. So calcified cyst, not that I know of, atrophic scars, visceral abnormalities. That's throughout the body. That's the stuff that you need to hold your organs in place, which is also what holds your joints in place. So your whole system, your brain, your heart, your pancreas, your gallbladder, your liver, all your intestines, your uterus, well, not for guys, your bladder, everything is held together by this tissue. Widely spaced eyes, not so much. Epicanthal folds, I think. Broad nasal bridge, no. Subcutaneous nodules, yeah. Gastrointestinal hernia, born with one at 4 years old. Diverticular effusion, issues. Synovial effusion, premature birth. Luckily I did not. Luckily all 3 of my kids did not. This is a genital, not genital, oh my gosh, congenital. It's a genetic issue that is handed down. So probably my mom had it, and like one of her aunts or whatever, or could come from my dad's side. Who knows? As we look back as far as we could and as deep as we could into family history, there were a lot of kind of indicators here and there. My sister has some signs. Unfortunately, Olivia has some signs with her joints, and I have encouraged her to be very, very, very careful about taping. I have to tape my shoulders every day because they don't really have a brace to keep them in position. I'm getting ankle braces. I will have probably knee braces. I wear this awesome thing all the time when I'm at home and when I sleep to help my degenerative neck. and my headaches. And it actually has helped, but it drives me crazy and it hurts my jaw. And I have TMJ and a bunch of jaw problems. I also have horrible teeth right now. My gums have receded so far, and I have so many cavities over the last year. It is so upsetting. I am trying not to cry. You would not believe the thousands and thousands and thousands of dollars that are required for me to get my teeth fixed. And I like having teeth, but our dental insurance maxed out, and evidently that means no mas. So we are working on that, trying to figure that out, because teeth are good. I already had to have a root canal. I had to have one tooth pulled. A lot of stuff going on. Not happy about that, but not my fault. I swear I brush my teeth and floss. Let's see, where were we? This is getting long. Congenital hip dislocations. A lot of babies are born with their hips out of joint. Club feet, I do not have. Crossed eyes, I can do it, but they're not there all the time. Blue membrane around sclera. So I do have blue sclera. So the whiter area of my eye has a blue tint. Perforation of eye globe, I hope not. Diminished cornea, myopia, glaucoma, easy bruising. It already said that. Pseudotumors. Also, inherited connective tissue disorders. You can also have a mitral valve prolapse. The last echocardiogram I had in 2011 did not show prolapse. It showed what's called mild regurgitation. So I'll be having another one of those. And man, I hope that I don't have that, because that is not a good one. Osteoarthritis. I've had arthritis. It was found when I was 15 years old. My back started to degenerate, and I was having all this back pain and pain down my leg. And people were like, yeah, right. And finally I got sent to a neurosurgeon, Dr. Claudia, here in town, and he did scans. At the time, there was no MRI in Salem. They sent me to Portland. I remember my appointment was at midnight, and I had my scan. Sure enough, I already had arthritis. I already had degenerated discs. I had bulging discs. I had all kinds of stuff already at 15. Didn't get in a car accident. Nothing happened. Could never explain why until now. And same thing for my neck. So I had to have neck surgery in 2009. Had my back surgery 2005. That's a tough surgery too. Kyphoscoliosis, which is a humped back. Atherosclerosis, valvular heart disease, osteopenia, and there's more. So, and then the periodontal stuff. A severe and intractable periodontitis of early onset. I had gum grafts when I was 18 and 19 years old, so that's kind of weird. Lack of attached gingiva. Things I told you folks, it ain't looking good. Yeah. There's that. Let's move on. So I've got this long list of diagnosis. Hypermobile, Ehlers-Danlos Syndrome, disorder of the autonomic nervous system, unspecified. This relates to basically the whole inside of my body and how my brain works, and why I have had heart issues, why I pass out, maybe some of my migraines, why I've had bleeding in my gut, had ulcerative colitis. Doctors couldn't even believe it. I've told them I've had it, and they're like, no, people don't get that till their 70s. Hello, I had it, I know. So there's that. I'm like, look up the records. So chronic fatigue, history of other diseases of the musculoskeletal system and connective tissue, family history of malignant neoplasm of other organs, blah, blah, genetic counseling, pain in joint, pain in hips, referring to all those other joints I said. Headaches, migraine, unspecified, not intractable without status migraneus. I also have cervicogenic headaches, which is because my neck's all jacked up and my head doesn't sit right. I get a lot of headaches from that, and we're hoping that the hard cervical collar will help that. I really, at this point, I'm glad I only have to wear it at home and to sleep, but my physical therapist did say when you go somewhere for like a full day kind of deal, put it in your car so that you can put it on when you want. I'm like, I'm gonna look like a freak because I didn't have it on before, and then I will go out to the car and have it on. And she's like, doesn't matter. I'm like, yeah, I know. So, blah, blah, blah. Inflammatory liver disease, which was caused from my gallbladder, and the big, huge blood clot that happened a week later. And that also caused my pancreatitis, which is very, very painful. Very painful. And that's when that man from the church said, am I just here for attention? I could have killed him. Could I have moved? If anybody even bumped the bed, I went like that. It's very painful. You will know when you have it. It's been one of the only 2 times ambulances come. And I was down on my knees, passing in and out. Had some liver issues, hypertrophies of the breast, valvular disorder of intestines, major depressive disorder, recurrent, asthma, hypothyroidism, which has resolved in the last year, so I'm lucky about that. Other specified extrapyramidal and movement disorders, so weird twitching and whatnot. Unspecified adrenocortical insufficiency. So for a long time, I was on asthma inhaler, a steroid asthma inhaler people take all the time, and it was called Advair. And I was very, very sick, and I was down. I'm 5'7", and I was down to like 125 pounds, and I could not get up to walk from my bed to the bathroom without starting to pass out or passing out. So I would have to sit down, short of breath, heart problems, all kinds of stuff. I literally missed my niece's wedding. I made it in the car to Utah, and I was miserable, in so much pain. My joints hurt so bad, and I was just in so much pain and so sick. I missed her wedding because I could not get out of that hotel room bed. It was awful. That is one of the very few times I thought I truly was gonna die. And no doctors could find a reason, and then they just kind of didn't care. They just kind of let it go. Went to the naturopath, Dr. Donald McBride, who's fantastic. I love him. And the very first visit that I went to, we described some things, and he said, I think I know what it is. Sure enough, he ordered the lab. It came back really bad, and he said, yep, this is what it shows. I'm going to send you to a specialist, an endocrinologist specialist at OHSU ASAP. Again, I called. She had like a 6 to 9 month waiting list. I start to cry. I said, can I be put on your cancellation list, please? 2 hours later, I got a phone call from them and said, we have a cancellation for a few days later. So then I cried out of joy and was all excited. Went to her. She treated it. Things are essentially back to normal. Have to watch it here and there. I cannot take steroids of any kind for more than a couple days without the possibility of this happening again, which really terrifies me. Let's see. Had diabetes, had it with all my kids, and had it between Mackenzie and Logan also. Supraventricular tachycardia, I had that. I had a heart ablation in 2005, same year I had my back, and to fix that. And now I have what's called inappropriate sinus tachycardia. And for no reason at all, my heart will just speed up to 120 to 160, 165 for no reason. So my cardiologist diagnosed me with that a few years ago. We tried to put me on some medicine. It really wasn't helping. I was having bad side effects. He said, let's just let it go. I said, okay, for you, fine. And he talked about doing another ablation, and I was not jiving with that idea. So syncope and collapse, which is passing out, collapsing, or starting to feel like you're going to pass out. Immunodeficiency. My immune system is so cruddy that if I'm around people who have colds, I literally will end up with bronchitis, sinus infections, bronchitis, even pneumonia. That's how stupid frail my immune system is at this point. I have to be very, very careful. I'm starting to become like a germaphobe. Other dystonia, this is getting really long. I recently, the last few times I didn't post things about being in the hospital, I had a bad reaction. I'd been really dehydrated, been really sick to my stomach, was dehydrated, and trying to keep up on fluids. Had a procedure at OHSU for my neck to help with headaches, and it is really hard to get in to see this doctor. And I was not going to cancel that. Kevin said, I think we should cancel. And I said, no way, Jose. So I was really weak. We went. As soon as she injected me, I took a Zofran before because I felt like I was going to throw up. She injected my neck, and then she kind of walked off, and I was supposed to sit there for like 20 minutes while they monitored me. And all of a sudden, my eyes started going back and forth, asking for another Zofran, and then boom, I was on the floor, couldn't see anything. I could see like shadows of stuff on the edges of my eyes, but everything else was pitch black. I thought I had my eyes closed, and Kevin said, no, they were open the whole time. So I was on the floor. My blood pressure was super dangerously low. I didn't have an IV in. I was it was not a seizure because I was awake, seizing my body and kicking and moving about in there, trying to kind of hold me down. And I was talking, but not very well. Like my words were really slurred and everything. And so, not good, really not good. At that point, there was one point when I was trying to look up, and I could hear Dr. Chen and Kevin talking, and I could hear how scared Kevin was. And I remember thinking, wow, this is it. This is it. Kevin tried to talk me out of it, and this is the way I'm gonna die. I was looking up, and I could kind of see these fuzzy squares, and for some reason I was counting them, and I couldn't focus on what was going on. I was in my whole other realm, and I remember them talking, and me looking up, my vision starting to come back, just very, very blurry. And I was kind of counting these squares and thinking, well, when I get to that last one, it's gonna just turn into infinity, and I'm not gonna be here anymore. And I remember I wasn't scared, but I was truly sad for Kevin and the kids. We hadn't told anybody except for a very close family about this, and some of them we didn't even tell how specific it was. I was in another building down below. They had to call an ambulance, take me up. I got up there, they put me in a room, and there was literally like 8 people in that room. Dropped my head down on the bed because my blood pressure was so low, and I could hear enough to know as a nurse that when they said my blood pressure, I thought, oh boy, this is not good. Oh boy, I'm going out. And I was in and out, and finally they figured out that my magnesium was super low, even though I take a huge dose every night to help prevent my migraines. And because I'd been so dehydrated, my medication had get concentrated in my system. My serotonin stuff I take for like my antidepressant and other stuff, and so I had serotonin syndrome. So it was a very bad case of serotonin syndrome. I stayed in the ER for close to 24 hours, and then had thrombocytopenia too. I don't know, don't ask. And then they finally let me go home. So for months and months, I could not see very well. and it was really irritating, really scary, and I was terrified to do anything or to go anywhere, or we had to explain to the kids, if mom falls down, she doesn't wake up, whatever, you have to call the ambulance. So there was that. And then recently in July, I was at my dad and stepmom's in Lincoln City, and I'd been on this new medication and kind of pumped the dose up. We were supposed to incline it, kind of pump the dose up rapidly to help me because my depression was really bad. And I woke up in a seizure-like state. I couldn't see. Everything was twitching and moving, and I punched myself in the face a number of times. Surrey basically saved my life. I was able to grab Surrey in the button and say, I couldn't talk very well. It sounded like this. Call Dad, call Katie. And I know that's horrible, you guys, but it was. So that's what happened then. The ambulance had to come get me. It was horrible trying to get me from downstairs to upstairs. And I went to the hospital. It was a horrible experience. My vision slowly came back, but when it came back, it was double vision for hours and hours and hours. I spent about 36 hours there just getting fluids, flushing the medication out of my system. And then a couple weeks later, I was home and took Livy to the hair salon, and it happened at the hair salon. And it came on fast, and they wanted to call an ambulance, and it was a Saturday, so it was very, very busy. And I did not want the ambulance coming. I knew what was happening. I told Olivia, call Grandma, tell her to meet us at the hospital. I knew we were 3 minutes away from the hospital, that Olivia could get me there faster than an ambulance could come and do what they needed to do. And they wouldn't know, and at that point I wouldn't be able to talk well enough to let them know. So she popped me in the car. I told her, call the switchboard at the hospital, tell them you need to speak with ER triage, tell them I'm having a massive dystonic reaction to Tegretol. And because I had been put back on a lower dose, and we thought it'd be okay. And evidently, I can't take that medication ever. And the whole seizing thing went on for a very long time. The speech thing was bad, the double vision. They kept me there for another 36 hours there. They flushed everything out, gave me Benadryl, did what they could. Couldn't really give me pain medication or anything, so it was Tylenol and ibuprofen. I hurt everywhere because every single muscle seized for over 4 hours each time. So I was very, very, very sore for a long time. And my eyes, I still have a problem adjusting from close to midway to far away and back and forth. So we'll continue. It's been a half an hour. So benign lipomas, thrombocytopenia, like I said, I had before. Endometriosis, had that surgery like 3 times. I told you about inappropriate tachycardia, post-traumatic stress disorder. We won't go there. Part of it's what happened before. Benign lipomatias, neoplasm, blah, blah, blah. Insomnia, horrible, horrible, horrible insomnia. Horrible. So if you see me on Facebook or Pinterest or anything and it's really late at night, it's because I have this horrible insomnia. Always have. All these people in my family have it. I'm like on the highest dose of medication I can take, and it freaks other doctors out, especially in the hospital. But it's really, really bad. And evidently now I have an explanation. So tinnitus, I have ringing in my ears that happens all the time. I'm like, Kevin, do you hear that? Do you hear that? And if something painful happens, I get this horrible like reverberating in my ear, and I'm like, the eye doctor thought that was awesome when he did something to my eye and it hurt, and I'm like, my ear. Disorders of ligaments, all of them. Family history, blah, blah, blah. Other insomnia, other general symptoms and signs. So the orders for the test, I have to have many, many tests. He is a geneticist in Bend, like I said. So I went over there by myself. Kevin had bought a voice recorder so I could record the whole thing. I was trying to take notes, and I forgot to turn it on. Yeah. And they don't take insurance. You have to pay up front and then try to get reimbursed from insurance. So he has ordered an upright, open, weight-bearing MRI of the brain without contrast to rule out Chiari malformation. Chiari malformation is basically your neck is very degenerated, your head comes down, and basically your brain kind of herniates down into your neck. So herniates kind of bulges down into the neck, causes a lot of problems. Headache, imbalance, passing out, all kinds of this other stuff. So he's very concerned that I have that. There's a number of different ways that they treat that, and they're all surgical, of course. Just gotta go for number 23, 24, 25. They're gonna keep coming. Now I know they're gonna keep coming. Not a surgery I want. Pretty not cool. Really hope I don't have it, but I have all the symptoms. They don't do those here. I have to also have it on the rest of my spine. They don't do those here. The only place they do them locally is Renton, Washington, and San Jose, California. So we chose San Jose because I like a little sunshine and happiness. So let's see, a tilt table test to evaluate for postural orthostatic tachycardia syndrome, which is what they believe that I have. My blood pressure drops very, very low. My heart rate increases very, very high to try to compensate for that, during which time I pass out, or I almost pass out, and I catch myself and I sit down. So if you see me ever sitting on the floor at the store or at church, if I ever get back there, or anywhere, that'd be why. Passed out a lot lately, so they think I have that. There might be some medications that can help. That would be great. So we're also doing a referral to a specialist who specializes in POTS, and we are doing an MRI on the right shoulder again because it changed so vastly from June of last year to July of this year. Horrible changes. And this shoulder, because this shoulder's messed up too. But I wouldn't let Dr. Fan even kind of check this out until this one was taken care of because it hurt more than this one. We also are doing MRIs of my right hip, which is one of my more painful areas. I have physical therapy. I'm already in physical therapy. At this point, I go once a week. In the future, I will probably go more or for a longer time. I don't know what the orders are, and it depends on what they find on my test. So, also have to get more splints and braces. This is where it gets kind of weird. So the splints and braces, I have to get some for my fingers. They're rings. They're actually kind of pretty, but they look like kind of exotic rings from India. And what they do basically is prevent like my thumb from doing this kind of thing. I know that's gross. If you can do this and some other stuff, talk to me. From going out of joint. It does it all the time. I'm like, ow, I pop it back in. So I have to get some rings for that. Don't know if insurance pays for them. They're like $150 a piece. I'm trying to figure out exactly what fingers I need. I have to get my ankle braces. I have to get my knee braces. I wear my neck brace. Hopefully I will not have to wear that baby around town because I will be a bitter, bitter woman. And it's hard enough to wear it at home. And so you might see me out in public, generally no makeup, hair in a bun, and you might see me wearing my neck brace. You might not see me wearing my neck brace. You might, my shoulders are taped all the time because there's not really effective braces to pull the shoulders back and upright. You will see me hopefully with my rings, I hope, ching ching, and ankle braces. It depends on if they're going to be, I ordered some that are not as hard, and then if I have to get harder ones, they will be really obvious ones. I also am probably going to have to get knee ones, but we'll see how the ankles, if they correct kind of the knee pain and movement first. So if you see me like out and about, and one day I have like these splints and braces on, and one day I don't, it's because of this. It's because I wake up with symptoms that are worse, or physical therapy, or my doctor tells me, no, you have to wear this for a certain amount of time, and I do this, but I do it. So I don't know what it's going to be like. Some people progress over a very long period of time. My progression recently has gone very, very fast, especially this last year. My teeth, my shoulders, some other stuff. I have a lot of gastrointestinal stuff. I am randomly, like, all of a sudden I have to throw up. I'm like choking on my own spit. It's gross, I know, but I choke on my own spit. I have a really hard time getting my pills down my throat. Anything I eat hates me. Any food. It doesn't stay. It doesn't stay. Either way, doesn't stay. So I'm getting IV supplements and stuff once a week from my naturopath with electrolytes and stuff, and I drink Gatorade and water and Ensure, the non-dairy kind, because dairy hates me. And if push comes to shove, I get a feeding tube. So they'll probably try one through my nose first, and then if necessary, they will implant one in my abdomen, and I will wear a pump. So that can happen. It happens a lot. If it does, it does. At least I will not spend so much time in the one place, one room I don't want to be in. So there's that. So I will be having an upper and a lower GI scope to check for that, a swallowing test. We are doing genetic sequencing, so a blood test that goes to a special lab takes weeks and weeks to come back. Yeah, some more autoimmune tests. I don't know what the heck. I have to have an echocardiogram to make sure that I don't have an aortic issue, the main branch coming down into your heart. Some people can have that where it's very large and it can rupture. You can die of an aneurysm. Not cool. Don't want to think about it. You have one in your brain. You can have one lots of places. They'll check me for my mitral valve again at that point and see if I have a mitral valve deformation. It can happen at any point during your life. So hopefully I do not have it. So at this point, I just want to say thank you for listening. I know it's been a really long one. If you bared through me through this whole time, God bless you. You are very sweet and very kind. It's been a long, long talk. So all of a sudden, all these things that are going on make sense. Almost everything I've ever had in my entire life has been due to this, and I just didn't know. So all the medications, these are my diagnosis, my allergies, my medications and supplements I take. Medications I take is needed down here. This is my list of surgeries. So the hernia is related to it, two of those. The adhesions in my abdomen, related. Sinus surgery, I don't think so, but had another laparoscopy for endometriosis and another sinus surgery the same day. Another laparoscopy, same. My cardiac ablation, Ehlers-Danlos, thank you very much. Lumbar fusion, Ehlers-Danlos. Tubal ligation, not Ehlers-Danlos. That's because the doctor said, no more babies for you. You have too many health complications. Too many. They do suggest people have this and they don't have children, that they have the genetic testing, because you have a 50% chance of passing it down to your child, which is One thing that I have a really hard time with, especially watching Olivia, and she's been to physical therapy for her knees and her shoulder and her ankles do what mine do, and I've tried to stress to her before we even told them, you have to wear your ankle braces when you play volleyball. You have to tape your knees. You have to tape your shoulder. You're going to have to go back to physical therapy. Now she knows why. She's okay with it. She kind of rolls her eyes, but when you're young, you don't think about it. And now she has to think about it, because once it's ruined, once it's torn, once whatever, you can't go backwards. You can't fix it. So even my carpal tunnels, those are another thing that are related. Not my hysterectomy. My Nissen fundoplication. So I had such bad reflux that I'd bend over and literal vomit would come up in my throat. So I had to have surgery to keep that. So now when I vomit, I know, so much fun information. Now when I vomit, not really anything comes out. Nothing's supposed to come out. Now liquid's coming out. So that's not good. My neck fusion related. I had the bone tumor a few years ago. You guys remember that? I don't think that was related to anything. Tonsillectomy and adenoidectomy, I don't think so. I did read somewhere it was, but other places don't. My gallbladder, yes. And I had him take my appendix out at the same time just to prevent further surgery in the future, because I knew it would come. And then the blood clot that happened after that I had to have surgery to remove. That was a scary time in the hospital because I was very, very sick and Casper the Ghost White. My friend called me translucent, which was true. My sister-in-law was fearful for my life at that point. Then I was back in the hospital with pancreatitis and later the liver stuff, all from complications from the gallbladder. And then the girl reductions to take pressure off my neck and my shoulders, and that's why a lot of my shoulders rotate, so I can thank for that. Then my my shoulder surgery, and at this point I don't know if he is going to do my shoulder surgery at this point, or if he's going to say, no, Amy, too bad, so sad, you have to just live with this. And then I'll cry again because I'm really good at it by now. And or he might say, we'll do the best we can, we'll fix it, but I have to do it a different way, which is fine with me. If he can make it any better, that's great. In the meantime, my naturopath is doing prolotherapy, excuse me, which is a technique that he takes a needle and like into my shoulder joint, into my neck, all down my spine. He puts it in, I know this grosses people out, puts it in, injects a solution, and then does this. Because the idea is to irritate the tissue so much that it grows more tissue. And so that's one of my only hopes for kind of improving this. This is a degenerative disease. I'm not going to get better. I'm going to get worse. I don't know how fast I'm going to get worse, or how slow. Slow would be cool, but lately things have not been going well, and so I'm worried about the fast. Some woman I was watching videos on YouTube, she went from running marathons to having the Chiari malformation surgery within 6 months. Another girl went from being a very active college girl to being in a wheelchair in 4 months. I don't know. I don't know. So I just pray for the best and grit my nasty rotting out teeth and pop my jaw in and out of place that hurts real bad, and hope for the best. There's nothing else I can do. So except for my physical therapy, I wear my braces, I wear my splints, And like I said before, you see me sometimes with them, sometimes without. I know it makes you seem like a crazy hypochondriac, but it's not. It's just the disease and the way that it works. So that's it. If you have questions, let me know. I'm really sorry that this was so long, you guys. Whoever's actually listened to this is a real trooper. God bless you. I really appreciate it. And if you guys see me and you notice that I've lost a lot of weight, it is because of the food stuff. I'm trying to wear like a flowy shirt right now that kind of hides some stuff, but don't freak out. Don't worry. Doctors are on it. I'm having lots and lots of tests. I generally do not do my hair. It's too hard for me to try to curl it and stuff. It hurts my shoulders. I will try to wear makeup when I go out. I do try. And I'm trying to make as many of my kids' volleyball games and performances as possible because I'm trying even harder because there's this kind of red evil clock and it's ticking, and I don't know when alarms are going off. So I have to make the most of the time that I have to make the most out of it without hurting my body anymore. It gets a little tricky, but I really push myself to go to the kids' games and stuff. It's really hard, but I do it for my children and because I don't know what's going to happen in the future. And the kids are really good about it. I don't think they understand everything. Who does? I don't. I'm a nurse, and I've been researching this for so long, and it's so confusing. I get overwhelmed. I have some days where I'm like, well, it is what it is. At least I have a diagnosis. That makes me feel better and less crazy, and I'll just take it as it comes and whatever. Cheerful, cheery. And then there's other days where I sit in bed and I'm in so much pain and I'm so upset about the unknown and the known that I cry. I just sit in there and I cry, and I don't want to talk to anybody. I don't want to do anything. I just have to go through a lot of that on my own. People ask me to do things with them, and I really, really, really want to do it, but they also get frustrated and quit because I have to cancel at the last minute because I don't know when I'm going to get sick. I don't know when I'm going to get stuck in that room. I don't know how bad my headache's going to be. I don't know how much pain I'm going to be in general. I don't know if I can walk very well. So I'm really sorry. I so want to do things with friends. I really, really do. But like, I can't even push a vacuum right now. I can't sweep. I can't mop. We talked to the kids about really helping with this. Not going well. And I know other people have offered to help, which is great. And I've talked to Kevin, and when clutter is picked up, then yes, okay, just talk to me. I need it. I just need it because I can't. I physically can't. So that's where we're at right now. And as I find out more, I'll let you know and try not to do an almost hour-long video. And God bless everybody that's always given me such kind words and sent me flowers and came to see me at the hospital and just the cute messages on Facebook and stuff. The last 2 times I was at the hospital, as I said, I couldn't see. So even if I wanted to post anything on Facebook to let people know what was going on, I couldn't because I couldn't read my phone. So I will try to keep people updated. It depends on the response that I get from this, quite honestly. So that hurt my shoulder. And love you all. You're all good friends and family. And it's just a big unknown right now. And the stuff that we know, I let you know. And we will go from here. So thank you. And if I see you and you say something and I get emotional, it's totally fine. I just am emotional. I tear up at the Pledge of Allegiance and the Star Spangled Banner, but that's because God bless the USA. And so don't be surprised by that. So thank you for your words of encouragement. And if you have hung in there for this entire video, I thank you very much. Okay, talk to you soon. Thank you. Love you guys.